this is affecting his work. So it turns out he wasn't really burnt out by the billion-dollar contract project it's involved in. It's depression at home with his personal life that was affecting his productivity at work, causing him problems with his supervisor, and now he felt like he couldn't do the job. Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. So, Dr. Khan, how do you know if you are just burnt out or actually clinically depressed?
Great question. And I think this is one where, it can be a little complicated and it can be confusing. I think one of the best things you can do if you're feeling burnt out is see your primary care doctor. Try to, where they can help figure out what might be contributing to the way you're feeling.
That's a great point because I have a story for you.
Yeah.
So I've got this patient, right? He's 44 years old.
Okay.
Works as a project manager, IT guy, of which we have a lot of that in the DMV.
Yes, we do.
And so has a pretty stressful job. They're working on a $1 billion contract, building something for the federal government. And so he's been working really hard, working long hours, and, barely has time to take care of himself, barely has time to take care of, his hobbies and his personal life. So he comes in for an office visit, said he was coming for a refill of his blood pressure medicines. Blood pressure through the roof, 175 over 105. So I asked him, so what's happening? Have you been taking your medications? All this while, he said, well, I was, but I ran out of it and I've not had time to get a refill. I didn't have time to request it from the pharmacy. One of those classic stories. And because he was busy. So I asked him, but the dangers that high blood pressure comports. We've talked about this in the past. It's like, yeah, doc, I know, but work has just been so stressful. So we get into talking some more about it, and he starts telling me about his personal life, how his marital relationship is falling apart, difficulties with the children, teenage children in the relationship, and how this is affecting his work. So it turns out he wasn't really burnt out by the $1 billion contract project it's involved in. It's depression at home with his personal life that was affecting his productivity at work, causing him problems with his supervisor, and now he felt like he couldn't do the job. And when I gave him a PHQ-9, and a GAT-7, scores were through the roof, confirming major depression and severe anxiety. So this is one of those classic cases in primary care. Why do we keep seeing mental health problems like depression and anxiety masking as burnout?
I think it's a lot of times probably the feelings of depression are they can be so varied, so many different symptoms. I also like to say, when somebody does have depression, it's not just like an illness or disease of the mind. It's a body thing, And so it can affect you with symptoms of so many different sorts. People have a difficult time putting it together. And so we sometimes just attribute it to, can't sleep, work stressed out, home life is stressed, and we just, I'm burnt out, I'm tired, So sometimes I think as people, we sometimes classify it as that. Sometimes people don't want to think that they're depressed, or sometimes they just are and they feel it, and then, they don't reach out for help, and that can go down in a negative way itself.
Well, you said something earlier that depression is not just a mind thing, it's also a body thing. I guess you are alluding to the concept of a psychosomatic disorder, like something that starts in the brain and then causes physical symptoms. How does that actually manifest in real life for the listeners? How does that happen?
So let's talk about some of the symptoms that you would experience, or some of the common ones that we make sure that we test for. Starting with number one, sleep. How has your sleep been? Are you having trouble falling asleep, staying asleep? You're waking up, you're having nightmares, etc. Loss of interest. That's another one where things that you used to enjoy doing, you no longer do. Like you used to play with your children. Now you're not feeling to do that anymore. You had an interest in a specific hobby, you like to play an instrument, and now not so much. You rather stay at home. Feelings of guilt. That's another thing that we ask patients for, is like anything that's going on in their life that they feel responsible for, or energy levels, are they lower or crashing compared to before, concentration issues, psychomotor agitation, suicidal thoughts. So like all of these different things we'll dive into and try to see if someone meets the criteria for depression.
So another statistic that struck me is that 1 in 6 adults will experience a depressive episode in their lifetime.
Absolutely, yes.
Which is
astronomical. And I've heard that number being as low as like 1 in 5 even, and about 30 million Americans go through mental health issues every year. So it's extremely prevalent. And when you take a step back and you look at the big picture, there's so much stuff going on in the world even right now, and with an economy even, and you think, the cost of living, all these things actually affect your average American on a day-to-day basis, and so then you have, you have a lot of that going on. It could be, like you said, in your patients, interpersonal marriage relationship, that's a big part of your life, or your job's on top of that stressful. So no matter where, this patient or individual looks, everything seems to be, it's like it's crashing or crumbling around him, right? And so I can completely understand why they feel this way,
So let's look at the science a little bit.
Yeah.
What's the difference between just feeling burnt out versus being depressed?
So one of the big things that we also look for as physicians is the duration of your symptoms. Have you been feeling down for a few days, a week, or has this been going on for a month? Has this been going on for 3+ months? So when it comes to sort of classifying or trying to diagnose, the time frame, the timeline of your symptoms also really matters.
Okay. So burnt out basically is a work-related stress.
Sure, yeah. For example, I wouldn't be expecting whole body issues or symptoms, from you being just burnt out from work.
Like
it would be very centered for work, and everything else should be fine.
Fine.
But if you're telling me, hey, work sucks, home stuff, there's a lot of stuff going on there.
Work sucks. Home sucks. Hobbies suck.
Yeah. Gas is expensive. Like mortgages due. And then you have a lot of different symptoms, like where when it comes to depression, like sleep is, you can have weight gain, you can have weight loss, you'll be extremely moody. Your mood can be fluctuating all over the place.
Loss of joy.
Yeah,
from life, basically.
Yeah.
Because sometimes, and this happens a lot in high-functioning professionals who straddle that overlap syndrome between burnout and depression, like the one I just mentioned, the case of my patient. And what they always tell me is like, Doc, I feel fine. I don't think I'm trying to jump off a bridge or kill anybody.
Yeah.
Because people always think of the worst type of depression, the outcome being killing yourself or jumping off a bridge or killing somebody.
Sure.
But the depression we worry about in primary care is that low-grade chronic depression where you just have no joy in life, but you keep going to please everybody around you.
You're like a machine. You're just like a machine going through life, right? And like you said, I think that's a good way of putting it. The joy of it is gone. You're just in a routine all day, every day.
Yeah.
And so these are things that if you do feel like you're suffering from, then it's worth exploring, because these symptoms can lead to a significant quality of life issue. If you feel like that every day, that can impact the way you treat yourself, you treat your family, your friends, how you function at work. It goes into all different aspects of life.
And I think this is where the primary care physician has his greatest role as a patient ally. Because you have to ask the patient the right questions. You have to investigate. You have to dig deeper.
Yeah.
As you very well know, we run PHQ-9s and GAT-7 questionnaires on all new patients, all annual physicals, every time, because situations change in people's lives.
100%.
And I think very often, because people get busy in primary care, we don't really take the time to sit down with the patient. We've said before, just one look at the patient can tell you if there's something different about this patient.
Yeah. I also like, when it comes to depression, your primary care doctor who knows you, and knows you over the years, they can pick up and sense, hey, Matt or John or whoever, hey, you don't seem like yourself today, or what's been going, they themselves can also sometimes sense and pick up, and maybe that starts a conversation that, the patient might not have been initially willing to have, but now that the doctors noticed it, now they talk about it and hopefully try to treat it, and so
we should not be afraid to bring up the topic of depression.
Not at all.
I mean,
because to the contrary, people who are depressed a lot of times don't want to talk about it.
Yes,
and they need someone to talk about it with, and so if not your primary care, then who, and because that's someone who really, really knows you, and it's a safe place, and
I've long said that I function 30% of the time as a psychiatrist in primary care.
I would agree with that. Probably more, I would say.
Yeah. The remaining 20% of the time like a psychologist.
In
primary care. And those are the joys of the profession.
That's where you really feel like you're making a huge difference,
Yes.
Yeah.
So, I guess then we'll leave our listeners today with these few action items, right? I think to summarize a few things you said for the patient's benefit, number one, if low mood lasts more than 2 weeks, you got to talk to somebody, especially your primary care doctor. Number two, protect your sleep at all costs. You need rest because lack of sleep eventually leads to burnout and or depression. And we said number three, reduce alcohol intake. Because many a times people use alcohol to treat both burnout and depression. And number four, strongly consider therapy and medication if appropriate. Don't be shy because there are tools to help you deal with these problems.
And even a little bit on that, I would just say, sometimes people also think, hey, I'm going to be on this medication forever, or something of that nature, and that's also not the case. Not the case, And if I could add one other point on your list, would be 5 or 6. I forget where we are.
I was
five.
at 4.
You're at 4. I'll add 5.
Yeah.
Is I would say exercise, and I say that because statistically, we're over the last few years, we are now seeing exercise is just as effective a treatment as a lot of your SSRIs or antidepressant medications, but it's free and it doesn't have side effects, and it really, really works. With exercise, your body chemistry changes, your hormones change, your mood changes, and as you do that consistently, it has huge positive connotations in regards to depression.
Fantastic. All right, Dr. Khan, thanks for joining me today.
Pleasure.
See you next time. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally. High-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.